Hi, everybody. My name is Khozema Shipchandler. I'm the president of Twilio Communications, and I'm delighted to be joined by Dr. Atreja from UC Davis Health. I'm really excited to meet with you today, Doctor, to talk about the way that you've been using Twilio's APIs to transform healthcare at UC Davis Health. Before we get into the conversation, I'd love to have you just introduce yourself and talk a little bit about your role at UC Davis.
Happy to, Khozema. Glad to be here. I'm Ashish Atreja. I'm a physician executive at UC Davis Health. I'm a gastroenterologist by background, but for the last 25 years has been focused on informatics, innovation, and now digital health and AI. My role at UC Davis Health is combining the role of CIO, running the hospital operations from the IT perspective, but also as a chief digital health officer, bringing the latest in digital technologies and AI so we can transform our health systems. So it's just been great endeavor being here in the last 2 years. Before that, I was at Mount Sinai as a chief innovation officer in medicine.
That's fantastic. It sounds like UC Davis Health has had a very kind of forward-leaning approach to the way in which they've approached healthcare. Why don't we start off maybe by talking about your vision as it relates to digital transformation at UC Davis Health? I know it was a major goal for you, for example, to have your team transition to what you're calling a digital front door. Can you just give us a sense for what you envisioned that transformation to look like?
Yeah, happy to. I was very lucky when I was coming here, we were going through an enterprise-wide strategic plan. And we came with the vision we want to deliver tomorrow's healthcare today. And within that, we identified Digital Davis or digital technologies and AI as a transformation catalyst to help us achieve that. So with that vision of delivering tomorrow's healthcare today, we started looking out what today's consumer expects: on-demand, 24/7, real-time care and questions, not being waiting on the phone line to get their questions answered. And also we can transform the experience. Based on the past journey and this, we realized that right now most of the interactions we have with our patients was either in person or on phone. COVID changed it when we were having a lot of intersections in exchanges with the patients on virtual, but that's coming to 15% or so now. So we envision as we go forward, the consumer of today, the patient of today, the caregivers of today will like to have a digital touch, and that could be 100 times more, ultimately 1,000 times more than in-person visits that may be, because it's much more convenient. It's at home. It can get you answers while it is and get to the right path. So with that vision of delivering tomorrow's healthcare today, we started looking at how do we start owning the experience of the patient's entire care journey. We came with the concept of Digital Davis platform. And one of the things we know is we did not want a point and click solution for one single service line because that leads to fragmented experience, and we can't own that experience. We can't change that experience. So we really are a big believer in platform approach, where we can create multiple experiences, thousands and millions kind of experiences on one set of technologies. That's a scalable pattern. So no matter where you are, who you are, and in which organization unit or which specialty you are touching, you get a similar level of experience that we want. And that's why we looked at Twilio as a transformation horizontal technology that will cut across all our patient experiences. And we think of digital front door as something which is transactional. I need to look at how much money I owe. I need to make an appointment. I need
Right.
to quickly go through triage. But that molds itself as we build more and more into digital navigation and digital automation. So they
Okay.
ask about this is the symptom they have. We automatically then provide them experience for the next appointment. We automatically triage if they need urgently to express care, which we have. So, and if they had a visit, we can automatically follow up to see how they are doing. And based on the visit, we are able to then follow up with a remote monitoring solution if that's the right thing. So we build from a transactional based digital front door to really getting deeper into clinical programs and clinical pathway and guide them to the next path.
That's so interesting. Now, I'd love to follow up with a couple questions. It sounds like you were quite clairvoyant in the way that you were thinking about the approach to the marriage of digital transformation and healthcare a while back. It sounds like, if I'm hearing you right, that COVID was really an accelerant to that approach. But were you also getting input from your patient base? Were they giving you feedback that these are the kinds of things that they would like to see? And then, obviously, over the last several years, again, probably accelerated by COVID, the notion of health equity has become a really big deal within the healthcare industry. And did you also see it as a means to address that problem?
Absolutely. In my prior organization, I had an SBIR grant on our digital equity. Here, we are fortunate. UC Davis Health is the third most diverse medical school. We are national leaders in promoting equity, including digital equity. So we had been fortunate with Congresswoman Matsui to get a federal earmark just addressing digital equity, where we were able to take the framework we had for express care. We were able to bring that to our partnering federally qualified health centers because many FQHCs, and I see digital equity as a multi dimensional challenge. While most of us think of digital health equity gap as or inequity as a patient or a care team who either does not have a device or broadband or skill set to do it, you can also kind of think of digital health inequity available among organizations who provide care. So
Mm.
federally qualified health centers do not have resources to bring all the tools. So they don't have latest AI tools. They don't have latest digital tools. So part of our mission is to not only promote equity to the patients we serve or to the care teams and the caregivers, but also as a regional center of excellence, how do we extend the umbrella of what we are building to our federally qualified health center or affiliate health systems, affiliate partners in that regard? And that we have started based on the prior research and this, we started seeing a very distinct pattern. And we are
Mm.
publishing on that as well. We started seeing a pattern. It's not easy. One is people do not have smartphone or broadband, but majority of the people who have equity divide is lack of skill. And
Hmm.
most of the health systems or health plans think having an app alone is sufficient. And that is going to bridge the gap. In fact, I believe having an app like a patient portal is just the first step. But most of the people do not even know how to navigate, launch an app, they forget their iTunes password, and then they don't know how to use it on a continuous basis. And it's not continuously engaging anyway. So we believe we have to go beyond the app to really address digital equity. And this is me saying while people call me as an app doctor, because I started a formulary to prescribe apps from electronic medical record. But our learning has been more around appless way, more around text as a digital bridge. That's where we believe Twilio really shone because we were able to see how about we send a message about appointment reminder,
Right.
message about what they have to find from their, pay the bills or other things right from a text message. So even if you have a phone which is not very simplified, we call it during the affordable care you get some simplified devices, you can still engage through a text. You do not need to download an app. You do not need to remember your username password. You can have any experiences baked within a text. Now we can also make that engagement available within an app if people want within a patient portal app. But we need to solve the last mile problem, and that's where that text first strategy is a very big strategy for us. going forward.
It sounds like, if I'm hearing you right, I mean, you really had a lot of appreciation for the fact that patients actually want to be communicated with in a variety of different ways. And that kind of leads me to think omnichannel. There's some customers that, as you said, want to be reached in app. There are other patients who prefer email, who prefer text message, perhaps others that prefer voice. How did that notion of omnichannel kind of inform your thinking, and how did that inform your thinking around Twilio in particular?
Yeah. So it's been a journey. We learned from our experiences through grants and others that people were consuming things differently.
Right.
But we did find the text first outreach actually shines nearly everyone and outclasses. Uh, so we have now Twilio turned on for our appointment reminder system, completely all the outpatient facility. It's a bi-directional text thing. We can add experiences. Around 10,000 daily messages come from us. But we also provide people who have a preference for not text but something else, or sometimes don't have cell phone. We are able to create IVR messages,
Hmm.
interactive voice response messages. And Twilio as a platform allows us through Twilio segment, we can then create profile of all the patients to say how are they engaging and their behavior. So next time we send a message, we can know this is likely gonna be sent and consumed in this manner. Uh, Also, we are able to do much more better with multi-language access, providing write in their own language, which is very tough to do in patient portals, but we can easily do that in text message. So we also find some of the things like running a big chronic disease program or a mindfulness program. Emails may be better because you
Right.
can have much more content for them. So I think based on that, we have a multi-channel process engagement where we can say text first as a first foundational element, but if it is much more richer content, we can give it through emails and other manners. And if it is people who don't have cell phones or people who sometimes don't have skill set, having a backup of interactive voice response system, which is not as rich, engaging as a phone app or a text message, but it is still gets the job done if we do it the right way. And all those tools were available in Twilio Studio for us to build, and they tie to the same level of engagement we can get through Twilio segment and measure that.
It's so interesting because the way that you're characterizing the journey that you yourselves have gone through, you're basically yielding internal productivity in the way that you're able to use some of these channels to basically accelerate different kind of workflows inside the hospital, or inside the care facility. At the same time, though, what's really interesting to me in the way that you've characterized it is that you're also able to generate a lot of productivity in terms of patients. You're able to personalize the ways in which you can reach a patient and deliver care. And I guess fundamentally, this is really about patient outcomes, right? And all of these things are in service of a patient outcome, which I find really just fascinating. The way that you've deployed technology in service of a patient outcome in ways really that no one else would have thought of.
And it's been a learning curve. I think we call it a learning health system. We have our digital Davis leadership program where we are training now 20 faculty members across all
Oh,
service
wow.
lines how to start using digital technology and AI technology in a meaningful manner. And it's just been an amazing journey. So just to cite few examples and outcomes, we have this model of return on health or return on value that goes beyond just return on investment.
Hmm.
For example, sometimes if a person has an aha experience, you may or may not be able to quantify that in hard dollars. But patient experience itself has a good measurement through net promoter score, right? So
Right.
we have a multidimensional way how we evaluate investment in technology. So we can look at not only hard dollars like no show rate reduction, uh, but we can also look at patient experience like net promoter score. We can also look at physician experience and burnout or clinician burnout by
Right.
not nurses not having to make all these calls again and again. It's
Mhm.
automatically engaging the patients and getting the things done. So big satisfaction for nurses as well and big retention. That's a big part of our pillar. And then improving the outcomes, which could be, and I'll talk about GI, it could be closure of care gaps for population health. So we are doing that Twilio now for closure of care gaps. It could be outcomes like colonoscopy. We are now we have such a big backlog of colonoscopy procedures. We're using Twilio to engage patients to tell them that first, your screening time has decreased from 50 years to 45 years. That's the national guidelines. You
Mhm.
should be aware. And then you have an option of things like Cologuard or stool test, which can get you tested without, the need for colonoscopy unless until you have red flags. And we are able to launch this entire campaign. And we were able to decrease when they do choose colonoscopy, we were able to show decrease in no-show by 50%. We were able to show improvement in the quality of the colonoscopy bowel prep by 30%. We had a net promoter score of 85. We had many patients telling the best part of doing a colonoscopy was his digital engagement. We did. So they knew exactly what to do, when to do, how to do, including driving direction and parking direction, and experience survey after the procedure or before the procedure. So you can see it's just been amazing to kind of deconstruct all the care we provide, put that into a paper in a design thinking manner, then reimagine that entire experience in an automated digital manner using all the best evidence of the technology, best evidence what we can do in clinical care. Uh, and it's fascinating to cut across cancer care to cardiology to radiology. We showed, actually, our partnership hospital showed a 40% reduction in no-show rate in MRI, savings
Wow. Wow.
$2 million.
So that's real productivity for the patient, real productivity for the clinicians, real productivity for the healthcare facilities. That's fascinating. And I would imagine, Dr. Atreja, that also all of these different interactions are kicking out a heck of a lot of data. And I know in the healthcare industry in particular, you need to be very careful about safeguarding data, and there are HIPAA guidelines. But how are you utilizing the data that you can use that's at your disposal to kind of create a feedback loop? You talked about ROH in terms of taking ROI one step further. How do you generate that return on health, leveraging data as a means to deliver an even greater outcome and just kind of mechanizing that feedback loop that you spoke of a moment ago?
Yeah, happy to. So return on health provides us two things. Once it provides us a yardstick for which are the highest priority things we should be. We go with a design thinking approach of problem first. Just
Okay.
because it's technology doesn't mean we start shooting it because we have limited bandwidth to implement. So doing an ROH calculation before allows us to pick the best, the most promising use cases. Then as an academic center, when we do it, we want to learn and share the implementation science with the community. So the ROH metrics help us to actually quantify the impact, publish on that, and actually share not only with other UCs, the 6 other UC health systems, but also across as an academic center with a larger community. The the data is a big part of the journey. So we just had Chief AI Advisor join in. Very much like we have a digital Davis platform on the digital side, we have a whole roadmap for digital Davis AI platform. And the
Mm-hmm.
things that connect the digital with the AI is the CRM or a CRM
Okay.
like mechanism. So you can see two sides of the coin: the digital part, which creates any digital engagement and digital exhaust, but we through the CRM able to map it in the right manner, and they actually create new data which sits along with our EMR data in a
Okay.
cloud-based system. So we call it new data, which is normally electronic medical record. You only have data about the patient when they did a visit in 6 months or 12 months.
Right.
You
Right.
don't have any data what's happening with them. 99.9% of the time, the health behavior change or any event that will happen will be outside that intersection with the healthcare system. That's when the
Mhm.
patients are at the home. And we have no way of capturing that. Now, with
Okay.
this engagement through Twilio and remote monitoring tools, through Care at Home and others, we are able to get a sense of all those patients' data. And that data, we map it along with our EMR data. Now, when we map it, then we can use CRM to first do mini experiences, micro experiences. For example, this person prefers text. Let's them share the text for closure of care gaps for breast cancer, for example. Or this person is actually pretty engaging very well with the patient portal. Let's give information in the patient portal and close it. But then
Hmm.
every data comes to us. So we can say, This person then had question which our live agent through Twilio was able to help. So we
Wow.
are able to then quantify, if we launch this program, 2% of them may generate a chat for our live person, and it will lead to 20% more appointments. So we are able to map through and through, like a system based approach, how much capacity we have. We are able to model that beforehand we launch a big program.
Wow.
So, right. So if we don't have data, and then we validate that with running the data to say, hey, we modeled it after this program after this, because we don't want to launch an experience if we don't have an access for that in the end. Right. So we tell patient, hey, this is available, but we don't have it available. That worsens the experience.
Sure.
So we have to
Sure.
model that in our heart, in a paper. Then when we launch it using the data, we are able to see, are we hitting exactly the same on the model point? Our assumptions were true or not. So it's a continuous, system based approach to kind of do it. But the other part with the data is we are creating a collective on generative AI called validai.health, which stands for Vision Alignment, Learning, Implementation, and Dissemination of Generative AI. And we are calling University of California as University of Collaboration and University of Convening,
Hmm.
because many health systems, or I would say no organization, no matter how big they are, can completely solve, address all the challenges of generative AI and the value creation that can happen. But we can
Okay.
do better together. So we're creating this collective, and where we want to take it is combine Twilio engagement. Hey, you have an appointment coming, or this is for you, this is the driving direction, parking direction, with completely turning on generative AI so patients can ask questions which have not been answered. Get many of those questions answered by generative AI, but wherever we have a delimiter or a stop where generative AI cannot answer it, it will connect it to a live agent on Twilio Live. So we
Wow.
can then get the answers through the human oversight, which is always need to be there. So you can see we can go what we call as from one to one, interaction to one to many, ultimately interactions, where there's a one human person here, either a nurse or a chat agent or a physician for express care, but a lot of the interactions are happening in an automated fashion using Twilio and generative AI. And whenever they are not able to reach to a certain point or they need to be referred to, then the physician or the nurse or the chat agent is there to solve them and take to the next problem.
Doctor, that's an amazing example. One of the things that I'd also love to touch on is just you're so fluent across a number of subjects. Obviously, you're an MD, which is your kind of your day job, but you've also taken on a much more significant role, as you characterized it, in kind of a CIO, CTO capacity, and are very, very fluent across your entire technology stack. Can you talk a little bit about, I don't know patients and nurses and other physicians in a hospital, but I do know developers, and you also interact with a lot of developers in the way that you're building out these different tools on your platforms. Can you talk a little bit about when you brought Twilio to your development community, like what is it that got them initially excited, and what keeps them kind of building things with such unique flavors on our platform?
Yeah, happy to. I think when I did my informatics fellowship, I had the luxury of doing programming, coding, and other stuff. And I realized that I may not be spending 100% of my time or majority of time coding, but just being exposed to that allow me how to intersect and break the communication barrier with developers and programmers. And that has been great because in my last 10, 15 years, I've been working very closely with in-house development teams as well as outside. So
Okay.
at UC Davis Health, when I joined in, we created Colab, which is in-house development team. So Colab being the collaboration partner, but it has a in-house development team of full stack developers, a front-end engineer, back-end engineer as well. So one of the things when we exposed Twilio to them, one is we were only looking at technologies which can scale, because where we are starting is nothing. Where we land up in 2 years, 5 years, will be 100x to 1 million times of where we started. So we wanted
Wow.
fundamentally to technology, use a technology in our platform, which have been tested in millions and billions of interactions. And Twilio stood out. The second thing we were looking for is something which can allow us to build experience, but gives us the flexibility to own those experiences, to build those. So it's not fully packaged content like a startup company that you can only do this. So with the API approach which Twilio has, we could build those experiences which are very unique to UC Davis Health, and we can evolve those experiences. Now with generative AI coming, we can use OpenAI or AWS Titan and use the generative AI bot right with Twilio,
Right.
right? So we're not hostage to anything, and we can quickly evolve. So that nimbleness in evolving, and also the scalability and the API first approach. So we're not doing custom development, we're doing configuration, but we are able to leverage a lot of the things that are already baked in, was something that really helped. The other thing that really helped is we gave them actually 2 weeks. We said, if this technology is good, you should be able to build an experience within 2 weeks. Otherwise, it's
Wow.
not intuitive, it's a steep learning curve, and we can't scale it. And within 2 weeks, they were able to create an experience which we felt very comfortable with. So I think even though it's a lot more scalable, API first approach, as well as allowing us ability and nimbleness to keep on evolving it, it's also user intuitive from a programming standpoint with a lot of good documentation, as well as HIPAA and security, which is taken for granted, that allows us to say, hey, our programming team can quickly build on this without them going through multiple consulting folks and investing a lot of dollars in outside teams to do it.
Well, that's fantastic, Dr. Atreja. I just wanted to wrap and thank you for your time. You've been a fantastic customer and a great spokesperson. What you're doing with UC Davis Health is really inspiring. It spans kind of digital health transformation, patient outcomes, now combining it with the latest capabilities in terms of generative AI. I just can't wait to see the future of what UC Davis Health becomes and frankly, what you build going forward. So congratulations on all of the incredible patient outcomes that you all have created. And I'm really excited to see your next step in the journey.
Thank you so much, Khozema, and thanks for being a great partner, guiding us and helping us serve our patients, clinicians, and employees better.
Fantastic. Thank you.
Great.